Hello, viewers. My name is Olori Giwa. I have here with me Dr. Adewale Adesanya, a renowned gynecologist, an obstetrician, an advocate of good living, good life, a preventer of diseases, and a promoter of good living. Hello, Dr. Adesanya. Good to have you here.
Hi, Olori Giwa. I'm very pleased to be with you today.
Thank you so much. Adupepe Akpeyin Edejewa. I've always had this topic in mind to always talk about. I mean, in the midst of women, but I'm glad that you're here today, so we can always clear the hair for a lot of women. Topic called menstruation, simple yet very complicated. So, Dr. Desanya, in a nutshell, can you explain to the viewers and also to me what menstruation is all about?
Thank you very much, Olori Giwa. Thank you for finding me worthy of this deliberation.
You're welcome.
It's always my pleasure, anyways. Menstruation, like you said, simple and yet complicated. Simple because it's a natural process designed by God Almighty, and with all its goods and the positives that come with it, and yet complicated, especially when it's associated with some symptoms and some issues that may look wild or look strange to an onlooker. So, menstruation is a natural process that involves the shedding of the lining of the womb. In the simple term, the womb, and this process happens every month. By month, I mean every cycle, because cycle is unique to individual lady. So this happens every cycle in a simple form.
Okay, thank you very much, Dr. Desanya. So I know we have a lot of questions. We have questions about menstruation. We have myths about menstruation. When I mean myths, I mean all these taboos and the common knowledge about menstruation, some which are correct and some which are wrong. So it's a good thing that you're here today, Dr. Desanya, to, clear the hair and to differentiate which is which. Okay, so I have before now I already spoken to a lot of women, and I'm here some of their questions.
Thank you very much for having me.
Okay, so the first question I'm going to be asking you would be, how much blood do you lose during menstruation? Meanwhile, hold that thought right there, please. Meanwhile, these are questions that are generated from some ladies, some girls, some young women. So they're not random questions picked on the internet. They're actually live questions asked by people. Okay, so go ahead, please.
Okay, thank you very much. Like I said about the length of cycle for women, menstruation comes in phases. The first phase is what you're asking. The first 5 days, 1 to 5 days. Get it? 1 to 5 days. So the length of time ranges between 2 to 7 days. 2 days to 7 days. And when you ask the volume expected, then it can vary from individual to individual. So it is generally believed that, well, between 20 to 50 mils. But the question is this 20 to 50 mil per day or for the whole period of? So what?
When you say, sorry to cut you short, when you say mils, you mean
volume.
In the quantity. Ml.
Ml, yes.
Ml. You mean 5 ml? I mean, I produce almost
20,
a bucket.
No, 20 mils.
I produce almost a bucket.
So 20 mils to 50 mils.
Okay.
Now, note, 50 mils can be excessive for some people.
Right.
When they are used to 20 mils.
Right.
But that is still within an acceptable range.
Okay.
Now, when you talk about producing buckets, by the time you bleed excessively, it is very, very important for you to find out why you are bleeding excessively. At times, the bleeding comes certain volume and is consistent, and there is no pathology associated, and there is no issue. with it, like maybe some symptoms like
Mm-hmm.
dizziness and other symptoms that are suggestive of low blood level in your system. If you don't have that, then you can take that to be your normal. Now, talking about bucket is like maybe exaggerating a large volume. When you're having menorrhagia, which is excessive menstrual loss, you need to see a doctor for
Okay.
proper evaluation.
Okay. Thank you very much for clearing that. Okay. Okay. So I have another question. And this this is very funny. Why do we have? Okay. So in no particular order, I'm asking the questions. Okay. So why do we have different tampon sizes? The tampon.
Okay. Talking about tampons, you are talking about now menstrual product. Tampon is one of the various menstrual products that you can use as a lady to keep yourself clean, comfortable when you are menstruating. So, tampon by design is meant to be introduced into your private part, the vagina, as the case may be, and it helps to absorb this menstrual flow. You will agree with me that, fingers are not equal. So expectedly, that space, of course, there may be variable sizes.
Right.
So you have to come
When
up
you
with
mean space, what do you mean by
the
space?
vagina,
Okay, the vagina.
space. So
Okay.
you might need different sizes that
I can fit.
that fits.
Okay, so I know as a young girl, when I started my menstruation, I used to have this pain. I mean, I no longer have it that much. Like I literally roll on the floor. I literally cannot even do anything. I cannot even go to school and all of that. So why is that? As a young girl, but I don't know if adults too go through that. But I know it's very common in young girls or first timers, so to speak.
Moving to the area where what makes menstruation a little bit complicated. When you say
Right.
simple yet
Complicated.
So now there is a certain level of pain that comes when you are talking about dysmenorrhea.
Okay, that's a medical term.
Painful menstruation means dysmenorrhea. So dysmenorrhea can be primary or secondary. So when it's primary, it means it's my people will say follow-come.
Right.
That one is follow-come. So that means from the start, when you started having your menstruation at puberty, you started having this painful menstruation.
Yes.
Now, in most cases, when it's primary, there is no pathology. There is no serious cause. Like, okay, maybe because you have a disease, that's why you're having it. There are various diseases that give painful period, but I don't want to mention them so that we don't deviate too much. So once it starts with your period when you started menstruating, it's seen as primary. In most cases, they are just natural. However, what brings this pain? There are technical explanation. I don't want to go into the details of that. What you need to do in that in such situation is to manage the pain, and if it's the simple analgesics and not taking care of it.
When you mean analgesics, you mean paracetamol?
No, well, that's one of various analgesics.
Okay.
I think you just need to see your doctor if the pain is so much
severe.
Then the second group that I talked about, which is secondary dysmenorrhea, most definitely you need to see your gynecologist to get the perfect solution to that.
Okay, thank you so much. Okay, so the next question was supposed to be, what do we call the menstrual pain? So you already cleared that. So
okay, thank you.
To the viewers, the menstrual pain or the menstrual cramps in the medical term is called dysmenorrhea or dysmenorrhea, like he rightly said. Okay, so another question that I have is